Hello, everyone. This is Dr. Vishal Gewali again. Today, I want to talk about evidence-based approach to practicing medicine. As you know, in my last lecture, I talked about how to prepare well for your medical journey as a medical student. Today, I want to talk something about how to prepare well when you are a resident or a fellow and advanced level training. During your medical studies, I guess you don't have so much time as to learn about the evidence for the treatment that we use in our daily life as clinicians. But during residency and fellowship, I think it is quite important that you dig deeper into the evidence. Evidence-based medicine is the foundation of treatment. We don't practice medicine based on what someone tells us to do, just because someone is a big name in your field and that person tells you that this is the right treatment for this type of patient. You don't practice that way. You have to practice based on evidence and what the data tells us to do for a given patient. Now, there are several types of evidence. Evidence does not always mean randomized controlled trial, but randomized controlled trials and meta-analysis from randomized controlled trials, they form the highest level of evidence. There are the lowest level of evidence would be someone's experience and case reports, and then there are cohort studies, observational studies, and the highest level of evidence is provided by randomized controlled trials. And if you want to know more about randomized controlled trials and biases in randomized controlled trials, you can watch my other videos where I teach about these things using slides. But today, as a basic primer, what I want to tell the doctors in the world is that, especially, let's say, in low-income countries, we practice textbook-based medicine or evidence-based medicine. That's not the right way to practice medicine. The right way to practice medicine is evidence-based medicine. If someone says, for example, that cisplatin plus etoposide is the best chemotherapy for small cell lung cancer, you don't take it for granted. You should demand why it is the best treatment for small cell lung cancer, and you should go to and search the pivotal trial that led to that recommendation, and you should read into the trial. You should read the trial in depth. You should look into the nuances. You should look into the eligibility criteria. You should think whether that trial applies to your patient or not. That's how you practice medicine. And the duration of treatment, how long should we give this, what are the side effects, all those things, they don't come from heaven. Like, these things come from trials, and you have to go and read that trial, and then only you will be confident about applying that trial to your patient. Having said that, there may not be a trial for every patient that we see in the clinic, and that's why we call medicine is not an exact science, because if there was a perfect trial for every patient that we see, meeting the perfect criteria for the given patient, then it would have been easy. But it's not the case. So sometimes you need to extrapolate. Sometimes you need to think whether the trial will apply to that patient or not. And if it does not, can you still extrapolate that? Or if it is harmful to extrapolate that trial data into your patient, you have to keep thinking about these things. You have to think why the patient will not have been eligible for the trial, and you have to think if you are doing more benefit than harm by treating the given patient with a given treatment. The first principle of medicine is first do no harm. So my philosophy of medical treatment is that I don't intervene unless I'm confident that my intervention makes a positive difference in patients' lives. But yeah, there will be occasions where you will feel that you don't have proper framework to work on. You don't have proper evidence to learn from for helping a patient in front of you. In that cases, it becomes a challenge, and that's where experience comes into play, and that's where discussing and learning from mentors comes into play. But fundamentally, you should be learning the evidence-based, the trials that leads to every treatment recommendations, and you should be learning about the biases in the trials, whether the trial applies to your patients or not, what the caveats are, what the nuances are, what the side effects are, how to make the best use of the evidence for helping the patient in front of you, accepting the fact that there may not always be a good quality evidence, but still you need to act, sometimes even in the absence of evidence. Yeah, that's the fundamental principle. Evidence-based medicine is a collection of good quality evidence, as well as using your experience or wisdom for the best possible outcome for the patient. And we can't practice medicine in blind. We have to be cognizant of patient preferences. Sometimes you might think that a certain course of action is the best course of action for the patient. Then you have to explain that to the patient, and still the patient may not feel like that is the best course of action for him or her. And then you have to respect the patient's wishes. That's called a shared decision making. But you have to make sure that the patient has understood what you know about his condition and has made an informed decision. For example, in my practice, sometimes I feel like the patient will benefit from treatment, from chemotherapy, but the patient does not want chemotherapy at all. I have to respect that wish. But I need to make sure that the patient has understood everything that I know about his condition, has understood the benefits, the risks, and the odds of odds in favor of him or her and not in favor of him or her by pursuing the treatment and by not pursuing the treatment. And sometimes I feel like the patient will not benefit from treatment. And the patient might say that, no, I want treatment at any cost. Again, there are other socioeconomic factors to think about, whether the patient can afford the treatment, whether the treatment is even approved, so many legal socioeconomic consequences. But the philosophy of evidence-based medicine and shared decision making is that you appraise the evidence well, understanding all the limitations of the evidence. You try to assess whether that evidence applies to a given patient. You make sure that the patient has understood everything that you are telling the patient about the evidence and his or her disease condition, and you make sure that the patient has made an informed decision, and then you respect the decision. At least that's how I practice oncology. Yeah, it's not easy, but it comes with experience and time. But most important, learning. At the very first steps of learning as a resident or a fellow, you should devote a lot of time to learning evidence, to learning the trials, the data, and more importantly, to learn the approach to evidence-based medicine. As the saying goes, you give a fish to a person, you feed him for a day, you teach the person how to fish, you feed him for his entire life. So learning individual trials is very important, but you should also learn the approach to appraising literature, the approach to reading a trial publication, so that if you have those skills, you can read any trial publications and get good inference from reading those trial publications. And again, if you want to know in detail about how to read a clinical trial paper well, I have other videos with slides in this same YouTube channel, and you can refer to those. Okay, good luck. I hope you all turn out to be a great doctors.